Cough is a very important topic, because cough as a symptom may occur as a result of changes in many tissues, depending on the type of tissue affected. A larynx epithelium, bronchial epithelium or internal membrane of gill arch, which causes swelling of the cough in man. Different symptoms and characteristics of cough. At the same time, in each of these cases cough is needed. Cough is not a disease but a kind of mechanical aid for cleansing. There is also the concept of dry cough. All types of cough we'll briefly discuss. Let's start with the most common type of cough, that is from a wet cough with a secretion present. When coughing, the secretion comes out of the lungs and throat. Laryngeal cough and the feeling of stinging, scratching, biting that this cough causes a change in larynx epithelium. In a right-handed woman, the larynx epithelium responds to feelings of panic, fear, panic. When the woman is frightened, she will scare her. It is said that this cough is triggered by the conflict of scared or afraid. While the woman is afraid, the ulcer of her larynx appears ulcer. And since the epithelium was as pre-existing as it is now and is in contact with the air, produces so-called external cutaneous sensitivities. This means that during the active conflict period, as long as the ulcer occurs, and during the widening of the larynx diameter, there are no symptoms. The biological significance of change is evident in the broadening of the respiratory tract diameter, so that a scared female or a woman without sounding out could easily breathe, not paying attention to the predator. When the conflict of terror is resolved, then laryngeal epithelial regeneration begins with the proliferation of its cells. During the regeneration process, the larynx epithelium becomes more sensitive than usual. This causes a very uncomfortable feeling of scratching in the larynx that causes coughing. 30. Then man makes a temporary relief by coughing several times. Descaling is necessary to get rid of the phlegm arising from the process of tissue reconstruction. The body cleans itself by disposing of the substance that is useless for him. The old name for this process is inflammation of the upper respiratory tract. The second case where there is a wet cough is inflammation bronchial epithelium, also called lower respiratory tract inflammation. About this place down, if there is a change, we call it a change of bronchial epithelium. In a right-handed man in reproductive age, if there is a conflict of concern about the territory when it is afraid of its own property area or area of influence, when someone or something threatens his property, when they want to pick him up, take away what constitutes his property. For example, they want to take over his interests. It threatens its revenue and is afraid of losing what belongs to it. Then during the active conflict period there are also symptoms of ulceration, which he does not feel at all, even in the case of a month-long conflict, or during his active period. We do not feel symptoms. We do not feel bronchial ulcer. We do not experience coughing, nor symptoms usually associated with the period of getting out of the disease. Only when the conflict is resolved and the person affected is calmed down, no longer have to worry about their own property which no one wants to take away and which is finally safe, an inflammatory recovery process begins. Previously ulcerative epithelium returns to normal in the process of cell proliferation, formerly referred to as bronchitis or bronchitis, and in more serious longer-lasting cases which are the same as bronchitis, malignant bronchial epithelial cancer, although it was a pneumonia possibly more severe than usual. It turns out that pneumonia, called pneumonia or bronchitis, as a result the process of bronchial convalescence. And when the described inflammation appears, the real conflict is resolved. So when coughing starts, if the conflict does not renew, it means the time to get out of the disease. So when someone coughs by phlegm or secretion, this is a normal symptom that indicates lung cleansing. When someone develops bronchitis, and he coughs little, then the phlegm becomes dense and lumps out. If someone coughs frequently, then the phlegm draining to the lungs, and in such form is excreted while coughing. Do not be afraid of it, just the phlegm is bubbling, that's all. Cough can therefore accompany the secretion. What is the so-called a special larynx program or a special larynx epithelial program, or a specific bronchial epithelial program? These are the states that are accompanied by wet cough. The phenomenon of dry cough was called in this way because there are no epithelial changes associated with it. There are no scars, blisters or epithelial areas affected by the inflammation. There is only cough reflex cough which cannot stop in any way. In the head is located the center responsible for bronchial motor and larynx. This is called the laryngeal muscle movement center, and the center of movement of the bronchial muscles, which is used when exhaling air. The center of bronchial muscles movement is on the right. The center of movement of the larynx muscles and vocal cords is located 1 centimeter below the center of speech. In the right-hand man, the relays in the bronchial motor center are affected by the so-called conflict of concern about property. This is not a threat and more about numbness, impaired mobility. This numbness arises not when a man suddenly realizes the danger that threatens him, but when he was attacked. Someone has attacked me and wants to take away something that belongs to me. For example, when someone stands on the edge of the road waving and calling for help and I'm afraid and stop to give it to him, then he will come to my car and put the gun on my head to steal a car. Man is numb with shock and dread. Not so much is the situation. What is the fear of your goods strong enough to not be able to run away? Said sensation of numbness or even paralysis, which is a reflection of the fear of property conflict. It affects the part of the brain that causes bronchial muscle weakness. Because Mother Nature did not make our survival dependent on the case. The particular feature of bronchial muscle weakness is its gradual progression. Even because of high or long-term conflict, bronchial muscles do not refuse to obey completely. At the very end, as a result of the conflict build-up, we will experience more and more difficulties breathing. When the conflict is resolved, convalescence begins, at the beginning of which breathing problems are still increasing. This is caused by edema of the bronchial media center, which still impairs the transmission of stimuli and thus the smooth functioning of the bronchi. When a special bronchial program reaches the point of epileptic crisis, we will actually observe the attack of bronchial epilepsy. She called it an uninterrupted, unstoppable, uncontrolled cough reflex. Man starts coughing and cannot stop. No phlegm or phlegm escapes from the lungs. You cannot cough. However, you cannot stop coughing. It is an epilepsy of bronchial muscles, which is called dry cough, and is often mistaken for asthma, but a completely separate topic, which I will not be moving at the moment. In contrast, in this case, the lung cough reflex, which causes in humans involuntary lung cramps and respiratory problems, is actually a symptom of the crisis. If someone in this crisis occurs and a dry cough develops, please calm down because the conflict that preceded the crisis has already been resolved. You just have to survive the symptoms of coughing without panicking and not having another conflict. What would be unequivocal to fall into a vicious circle? How can you fall into a vicious circle due to robbery? Well, the man starts coughing, and since the cough does not go away, he is frightened that maybe something serious him. He starts to fear for his health and falls back into conflict, which turns off the fuse exactly in the same place. If someone screws it up, the cough will return regularly. It can take even longer time. So in right-handed men, the fear of ownership conflict can trigger an extraordinary program of epithelial and bronchial muscles. Although none of them is deadly, they are uncomfortable and tiring. Therefore they should be alleviated by treating the symptoms of the crisis. On the left side below the larynx epithelial center in the motor cortex, there are laryngeal muscle relics, about 1.5 centimeters under the center of speech. These motor relays control the muscles of the larynx and vocal cords. That is how we get out of our voice. The speech center moving mouth. Let us form words and sentences. On the other hand, a laryngectomy center allows you to speak. He manages, directs and implements. In a right-handed woman of puberty conflict, the fear is manifested in the numbness of the larynx relays. The woman is suddenly attacked. It is not a long-lasting fear but the sudden need to escape which cannot be realized. Therefore, when a woman cannot escape, and yet he is afraid, the body will not cause ulceration of the bronchial epithelium and thereby widen the airway. Only impaired larynx. As a result, the vocal cords, cripper or even voice disappears completely. I was scared and could not speak. This is a biologically justified reaction of the body at the time of the attack on the female in the nest. Let's say the male went to the hunt for caring for the family. He will return only in the evening, bringing home a dinner. Meanwhile, before the apartment or home, a stranger appears, causing a woman's horror. How does a terrified woman react? Of course her pulse jumps, she gets excited and being frightened in the beginning. But in order not to be able to make a sound of what she would call the striker's attention, so that it can pass the slot without noticing it, the organism weakens the vocal cords and the larynx muscles. The threatened female does not pay attention to herself, for example by making sounds. This is an interesting biological reaction of the body, whose logic we can only understand by studying the history of evolution. So given the data on the history of evolution, physiological data, and the environment in which extraordinary biological programs were developed, we can understand its meaning. During the extraordinary program of the larynx muscles in his active period, partial paralysis occurs. This means that the affected person will have a hoarse voice, or even completely disappears. Conversely, when the conflict is resolved, convalescence will begin and the synaptic ligament located here will swell back to normal. Then we feel in this place in the temple area headaches like stinging or stabbing. When said nodule is in an automatic period, the state of man apparently seems to have deteriorated, because he still cannot raise his voice or use the larynx. During the crisis, a larynx epilepsy occurs, in the form of coughing cramps. The man then coughs from his throat, coughing, unable to stop the cough reflex. When the daughter of one of my friends left for work abroad, She started reading articles about rape and exploitation, unaware women who go to work for prostitution. Because her daughter was working in a club, her friend was afraid she would not be made prostitutes. No imprisonment or involvement in anything bad. She did not want to lose her daughter. It was still upsetting her. She was terribly afraid of it, and it was causing new recurrences of conflict. This was followed by years of systematic recurrence dry cough attacks. I talk to her and she replies, and she still cries and grunts in that way, unable to stop. So this cough in fact is a contraction of the muscles, which arises as a result of a conflict of fear. When the conflict is finally resolved, cough will calm down. Eventually it will completely disappear and full functionality of the larynx will return. These are the most common reasons for coughing. There are two types of wet cough associated with phlegm separation, and there are two types of dry cough. These are caused by muscle tremors when a person can literally stop coughing. No matter what kind of cough we talk about, it always comes out when you get sick. It does not matter whether it is associated with a special epithelial program or a special motor program. When discussing cough, I would like to draw attention to yet another special program. Occurs as often as previously discussed. Well, that cough also occurs in the pleurisy. Only here are other feelings, otherwise cough is qualitatively different. Let's look at the example, the fifth of the frequency of occurrence cause. This is a special program of the internal gill arch. The gill arch name comes from the cervical lymphatic channels, which in the early stages of organism functioned as veins. The proof is that the internal membrane that covers them from the inside has the same structure what as the epithelium covering the interior of the carotid artery and other large coronary arteries. The inside of the vein is lined with epithelium in the event of an obstacle on the way of blood circulation. In this situation, by reducing the thickness of the epithelial layer, the diameter of the blood vessel is widened. So the body copes with the need to maintain cardiovascular fitness. Thus the interior of the lymphatic channels is covered with an inner membrane, which forms a very thin layer on the inside of the ducts. If someone suffers from a so-called conflict of frontal fear, feels fear of confrontation, shivering from illness, afraid of symptoms, or dangerous situation. In new medicine we say that the frontal conflict of fear is trembling with fear of dangerous, unmanageable, embarrassing situation. He is afraid of the situation without a solution, which turns into a physiological conflict because the man is afraid that in the present situation will become powerless. He will not be able to cope, will get into trouble. He will take a blind alley without the ability to rescue. Between ourselves we call this what now will conflict. During the conflict period, as it relates to epithelial tissue that is an internal barrier, hypersensitivity appears. In the neck at the jugular veins. If someone touches this what now will conflict, man starts to feel painful sting, because it may occur on such a stretch. It takes some experience to distinguish between different types of pain. Anyone who does not know it is a layman. He will not be able to accurately determine the origin of the pain. It will just show sore spots which will be subjected to the study, its heart, lungs and pleura, but no disease will be detected. This is because in conventional medicine it is maintained that the gill arches and thus the lymphatic channels do not have an internal membrane, so there can be no inflammatory changes there. However, it has been found that there is an unprecedented structure. Thus inflammation of the inner lymphatic jugular lymph nodes is diagnosed as non-Hodgkin's lymphoma, NHL. The name is derived from the fact that the inflammatory lesion is not covered by the lymphatic channel itself. Just something else. So it is said that this is lymphoma, not lymphatic channels. It is not said that it is inflammation of the inner lymphatic channels. Only that in the lymphatic system was formed some kind of non-inflammation. In short, non-Hodgkin's lymphoma is nothing more than inflammation of the internal jugular lymphatic channels. Can it cause coughing? The inner lumen of the cervical lymphatic tract runs from the face from the height of the ear through the neck downward, ending in more or less mediastinum, mid-chest. If the mentioned inner membrane is affected by inflammation, inside the lymphatic channels are epithelial valves that prevent lymphatic retraction. Then phlegm appears lining the inner lymphatic channel, which we can compare to the catarrh occurring during upper respiratory tract inflammation. Because of the valves, this secretion cannot go back, which makes it go to the lungs. This is a one-way process because the valves prevent backing down. Phlegm is pressed into the lungs, and filling their tissue causes swelling and increased lung volume. It also causes a very uncomfortable feeling and cough reflex. Man feels he has something in his lungs. However, he cannot cough up. Discomfort is all the greater. It is not known what causes this feeling of pressure in the lungs. Man starts to be afraid. I would like to say that Mother Nature was very gracious to us. She was wise and predictable. Well, let's just think if there were no lymph nodes in the cervical lymphatic channels. It would not flow to the lungs, whose tissues are very absorbent and without complications. Even if we experience discomfort, may accept this secretion. However, this does not cause any complications. You cannot die from it. You cannot strangle it. Man has a very strong intense cough reflex, and feel the pressure in the lungs. Mother Nature has acted very leniently, because imagine if the phlegm could go back through the lymphatic channels. It would hit the brain. She would fill it as it fills the lungs. What in the short term would be fatal. Because Mother Nature was gracious, she invented valves that cause the secretion to pass temporarily to the lungs, which causes a feeling of discomfort. In this case, cough also makes sense. When a person is affected by a similar pulmonary edema, it will be stated in their description that the shadow in the lung is visible. You will not be able to determine exactly what that is. It will not be known that there is a swelling that may occur locally and cause such symptoms. That is why it is said that there are visible spots in the bronchial area and at their branches. Let's remember that the airways are thickest there. There are cartilaginous bronchial rings, which prevents them from crushing. The trachea and respiratory tracts are made up of cartilaginous rings which are also present in the bronchi. So even if I do not know how uncomfortable was the feeling that in the lung area of man is present stain, located where bronchial and pulmonary veins branch, it cannot happen. This is just a feeling of discomfort. Therefore, the symptoms of the crisis in this particular program were called panic attacks. Therefore, I do not hide that the pulmonary edema accompanied by cough is associated with a panic attack. I will also add that the stain, which can be seen precisely on the X-ray pictures as a circular shadow on the lungs, and which is not stain but edema, in order not to go out for fools because of the inability to find cancer cells in the study extracted. It was called small cell cancer of the bronchi. Well, small cell carcinoma of the bronchi is not small cell, nor is it cancer, but lung edema. There was an all from the bag. In this case, conventional medicine understood something as well. Dr. Hammer says that in principle no disease has ever been diagnosed correctly, which does not mean that the researchers are blind, deaf or handicapped, but that they only saw the symptoms. They wrote them: there is redness, there is cough, there is visible stain. But they did not know what was going on or why they were so. They could not control the disease. They could not understand it. That is why it started completely unnecessary, afraid of him. So the famous microcell bronchial carcinoma is nothing but lung edema. This is caused by the secretion of lymphatic secretions into the lung resulting from inflammation of the cervical lymphatic channels. There may also be coughing. So if someone comes out, the main thing is not to fall into conflict again, causing these symptoms. So in the conflict of fear and the what now will conflict, do not give yourself this feeling. As we already know what is happening to us, exaggeration is afraid. The most important thing to know is that we will not die or suffocate. These symptoms must therefore be held. Antipsychotics can be used. Analgesic painkillers, acting on the principle of temporary removal of edema of the cyanotic nodules, giving relief to the pain of the tissues. Most importantly, you cannot die from it. So I described the fifth cause of cough in terms of frequency. That is why it is so common that many people fall into this controversial conflict of fear. And many people undergo panic attacks. Specifically when someone cannot get out of such a conflict for 3 weeks, being under the influence of fear of what will happen. Then the conflict ceases. Then after these 3 weeks, in the first week after that, swelling will appear. Next week we can see the circular shadow mentioned above. And in the third week the change goes back and eventually disappears. In the second week of convalescence, that is in the fifth week of the conflict, comes a panic attack. Accelerated heartbeat, general excitement, which at the level of the psyche manifests itself as if man controlled the autopilot, something we feel, although there are no specific symptoms. As with the epilepsy crisis in the physiological process, at the level of the psyche there is an emotional tension that arises from the experiences of the active conflict period. We think then, what will happen to me now? This feeling was called a panic attack. If someone regularly falls into such a conflict, we say that he was frightened by the panic attack. Then stressing it falls into a vicious circle. Suffering from panic. Of course there is no such thing as panic. This is an old unused term, meaning repetitive panic attacks. They happen because a man, a woman, or a man is still stressed by what can happen. The sixth most common cause of cough is a particular pleural program. Someone is scared, telling him that he has a stain on his lungs, adding that it was just not the cancer from which they will be metastatic. This causes stress in man. He thinks, my God, I have something in my lungs. Maybe you need to cut it. They will open me, they will cut. What will happen to me now? There is fear of being exposed to damage and the excitement associated with it. Man is afraid of his body, about his lungs. This feeling produces a thickening of the pleura. The pleural thickens unconsciously without causing any ailment. I even saw a fist-sized tumor in my chest, which grew slowly, not giving any symptoms during active period. Of course you do not have to grow enough. For such a large tumor it takes 2 years of growth. Suffice it that the pleura thickens a few millimeters. What happens as a result of everyday life conflicts, which produce up to several millimeters thick? During the active period there are no symptoms. When the conflict ceases, pleurisy appears. Ladies and gentlemen, I want to announce that there is no pleurisy without preceding him pleural mesothelioma, the appearance of a tumor. That is its earlier bold. If someone develops pleurisy, it is also very uncomfortable. In fact, the discomfort experienced during convalescence depends on the amount of pre-existing conflict. Inflammation causes cough. Here again I refer to the fact that different types of cough are different from each other. Not during free air intake, because no irritation caused by the friction of the lungs, but with deep inspiration when the lungs move relative to the pleura, causing chest pain. At the time of getting out of the disease, that is during pleuritis, she is very sensitive. There is a feeling of scratching, stinging, burning. When we get air, it is like someone sandpaper ran through the lung or chest inside. It is then that cough occurs in man. So during this particular program, coughing is triggered by the feeling of discomfort caused by the symptoms of pleuritis. And here also there is a sense of cough occurring in Mother Nature, because behind his case lung lobes peel off the pleura and do not adhere all the time to the area covered by the inflammation. This makes it possible to clean it out of the secretion there. Coughing thus allows the cleansing process. So even in the case of mild lasting weeks of pleurisy, there is coughing, which occurs due to its hypersensitivity during this period. This would be basically the sixth most common cause of cough. There is one main rule. Cough, although not looked at him, appears during convalescence. If only man does not fall into new conflicts. Because if someone falls into a vicious circle, even though it was still half an hour before he was active, he is already beginning to cough. The changes happen quickly after each other. What is important after the conflict is over is that a special program ends and coughs